When I was diagnosed in medical school, I was really ashamed of my diagnosis of narcolepsy, and I tried to hide it. I didn't want anyone to know because I was afraid that I wouldn't, have opportunities. And I wish that I would have told someone. Hi, my name is Lindsay McCullough. I practice primary care and sleep medicine.
My name is Marleny Macario, a physician, a clinical neurophysiologist.
My name is Luis Ortiz. I'm a pediatric sleep disorder specialist. I have type 1 narcolepsy.
I was diagnosed with narcolepsy without cataplexy 6 years ago.
And I have narcolepsy type 2 or narcolepsy without cataplexy. So I was diagnosed with narcolepsy when I was in medical school.
And I got the diagnosis just before my training.
It was only when I was about to fill out my third year of college that I realized that something was wrong.
And even after the diagnosis was still challenging because I felt like, okay, this is something that I'm going to have to live with for forever.
It didn't really occur to me that this would be a problem in becoming a doctor. But then again, I also didn't realize the severity of it all and how much work it would require to manage this. So medical school was a wake-up call.
Well, my mother, she has always wake me up. She used to call me every morning to wake me up.
I was struggling with balancing school and getting to my appointments and getting my medications and being able to study enough.
Due to the lack of knowledge of narcolepsy, I really felt like I did not have much support throughout med school. And I think part of it was that I underplayed how much narcolepsy was affecting me in my life.
I used to say, I feel like my eyes are sleepy. I'm not sleepy, just my eyes.
I had to take some perspective and think about my specialty choices.
My experiences in medical school really led me to, or forced me to, develop really good sleep habits and self-care, as well as pushed me to learn more about narcolepsy and other sleep disorders. I think that ultimately led me to where I am today in terms of being a sleep disorder specialist. Any doubts I had about my ability to be a physician kind of faded away as soon as I was able to move around, interact, do my own thing.
My mentor in Florida, she really helped me see that I was doing a good job. And she'd say, look at all that you've done, and look at your patients are doing great, and help me reflect on the things that I was doing well rather than to dwell on the things that I thought I was failing at.
A very important support, it was a boy that I met during the residency where I was living. He helped me to figure out what was going on with me. And eventually we were dating, and then we got married, and now we have a baby.
When you're in healthcare, especially in medical school and residency, we all want to be the best and we want to be performing at a level that an experienced physician would, and we're all still learning. Every time I had got a question wrong or didn't know the answer, I'd blame it on my narcolepsy, and I was just learning.
Being diagnosed with chronic neurological disease probably has helped me to keep going.
It just took some time and some prioritizing of my own self-care. It took the right medications.
And I did it, but it was hard.
At many points during residency, I felt like quitting. Now I'm so grateful that I didn't do that. I make sure that I am getting my rest at night. I do not eat any carbohydrates during the day because they make me sleepy. And then just being strategic with caffeine and medications.
And also be willing to take naps. Naps are so important for me. I have a little office, and if I feel that I need to take a nap, I close the door, I pull out a pillow from my desk. However, there's some days where it's just really bad. You're in front of a computer trying to type out a note or a report.
So I should take a nap, and then I can continue and do what I want to do in less time.
When it comes to divulging whether I have narcolepsy or not, I was really struggling with that for a good chunk of my medical school career. But my experience in med school did get a lot better when I did that. And my reviews got better. And I was able to take naps. People were more willing to let me take naps once they know that you have a sleep disorder.
That was kind of easy. The part that wasn't so easy was to find the place where to take the nap.
I am open about my narcolepsy with my co-workers, and we'll often take a quick nap on my lunch, maybe in one of the clinic rooms for about 20 minutes.
When I don't meet their expectations, they understand that it's not because I'm deficient in care or compassion or interest, it's deficient in hypercretin.
When I had like a patient with probably narcolepsy, I shared my diagnosis and they were like kind of relaxed.
I sometimes will reveal that I do have narcolepsy if they're feeling really down or struggling. Being that advocate for them and working with them is really special, and one of the things that drew me into sleep medicine.
I learned that practicing medicine is more than just prescribing medications. For example, at the beginning, taking a nap for me was like a waste of time. But then I learned that it wasn't. The waste of time was trying to work while I was sleepy. Sharing this experience with the patient helped the patient to understand and take seriously the recommendation.
And people with narcolepsy, especially teenagers, they appreciate being able to talk with someone that's been there and is able to give them tips and expectations about what might happen when they go to college or beyond.
I think it is so important to raise awareness for narcolepsy, for all sleep disorders and sleep health, really.
Narcolepsy, it's invisible and misunderstood condition.
What is presented in the media is borders on not real. And so when a person with narcolepsy is not doing well in life, they get ignored because they don't meet this preconceived notion of what narcolepsy is.
So many patients are living with sleep disorders and they don't know it, or they're not getting enough sleep, and it's impacting their health, it's impacting their quality of life. There are options for treatment and to improve. And if I wasn't diagnosed and didn't have treatment, I couldn't be a doctor. You have to be okay with changes. So I'm learning how to be okay with changes.
I haven't been working. My baby girl was born just before the lockdown here in Spain.
We switched over and are doing a lot more telemedicine.
And usually distance can be a limiting factor in getting the appropriate diagnosis and treatment for a sleep disorder, because sleep medicine providers are not that common, and sleep medicine providers for children are even less common. Having a way to do this remotely is very helpful.
One of my plans is to open a sleep center in Guatemala. I think it's going to take a little bit more time and we'll have to wait.
Disclose to anyone that you think is important in your career that you have narcolepsy.
When I took my boards, I would lay my head down if I had some time left and just pray that I would wake up. And so I wish that I would have just asked, because I have the diagnosis, and that is something that can be accommodated for.
One thing I also support is seeing a therapist. I think there's a lot of baggage with having narcolepsy.
I wish I would have given myself a little bit more compassion.
Don't fight against sleep, because sleep is always going to win.
No one is perfect. People without narcolepsy are not perfect either.
We are going to need probably some adjustments.
With medications, your symptoms are controlled and it doesn't affect your ability to be a doctor.
You are doing better than you think you are.
And I don't want to give the false expectation that if I can do it, you can do it. Everyone's different and everyone has their own path to get control over their narcolepsy. But I feel, on the other hand, that everyone has within them to achieve their dreams and goals.